I welcome you all for another lecture on the topic, Antifungal Agents. In this module, we are going to discuss on the introduction to fungal infections and classification of fungal infection. Antifungal agents with its drug, mechanism of action and ADR uses. So let's enter into the topic. Introduction. Let's understand the concept. Fungi are also called mycoses. Fungi are eukaryotic cells. They possess mitochondria, nuclei and cell membranes. They have rigid cell walls containing chitin as well as polysaccharides, and a cell membrane composed of ergosterol. Antifungal drugs are in general more toxic than antibacterial agents. Difference between bacteria and fungi. Bacteria contain peptidoglycan present in the layer is cell and consists of naga and nama. Fungi consists of polysaccharides both simple, beta-glucans 1,3 and 1,6, and complex. In bacteria, cell wall is composed of proteins. Fungi polysaccharides, chitin 80% of nag, constituting the cell wall. Bacteria lipids present in the cell wall are made of cholesterol. Fungi cell wall is made of ergosterol. Fungi can be divided into 4 classes: yeasts, yeast-like fungi, dimorphic fungi, molds. Now let's see the classification of fungal infection. Fungal infections can be classified based on the depth of tissue involvement. The 3 main categories are superficial infections, cutaneous infections, and subcutaneous infections. Here's a breakdown of each category. Superficial infections. Location: on the surface of the skin, hair, and nails. Examples: dermatophytes. These fungi infect the skin, hair, and nails and cause conditions such as ringworm. Examples include trichophyton, microsporum, and epidermophyton. Candida species commonly cause infections in moist areas of the body such as the mouth, oral thrush, or genital regions, vaginal yeast infections. Cutaneous infections, location, affect the skin, hair, and nails, but extend deeper than superficial infections. Examples: ringworm infections. Dermatophytes can cause infections that involve not only the surface, but also the deeper layers of the skin. Tinea species refers to various types of fungal infections caused by dermatophytes. Subcutaneous infections, location, involve tissues below the skin such as muscles, fascia, and bones. Examples: deep mycosal infections or systemic mycosal infections. These infections are more severe and may spread to internal organs. Fungi. Various fungi can cause subcutaneous infections, including species like Sporothrix schenckii, which causes sporotrichosis, and others like Fonsecaea and Cladophillophora that cause chromoblastomycosis. It's important to note that systemic mycosal infections can further be categorized based on the specific organs or systems they affect, such as pulmonary mycoses, lung infections, disseminated mycoses, infections spreading throughout the body, and central nervous system mycoses, infections of the brain and spinal cord. The severity of fungal infections often increases with the depth of tissue involvement, with superficial infections being less severe compared to subcutaneous and systemic infections. Here's a breakdown of the sites of action for common antifungal drug classes. 1. Polyenes, target site. Polyenes, such as amphotericin B, target ergosterol, a key component of fungal cell membranes. Mechanism of action: they bind to ergosterol, disrupting the integrity of the fungal cell membrane. Effect: this disruption leads to increased permeability, leakage of cellular contents, and ultimately cell death. 2. Imidazoles and triazoles. Target site: azole antifungals including imidazoles, for example clotrimazole, and triazoles, for example fluconazole, target the enzyme lanosterol 14-alpha-demethylase involved in ergosterol synthesis. Mechanism of action: by inhibiting lanosterol 14-alpha-demethylase, these drugs interfere with the synthesis of ergosterol, disrupting the fungal cell membrane. Effect: ergosterol depletion weakens the membrane, leading to increased permeability and fungal cell death. 3. Allylamines. Target site: allylamines like terbinafine inhibit squalene epoxidase, another enzyme involved in ergosterol synthesis. Mechanism of action: by blocking squalene epoxidase, allylamines disrupt the synthesis of ergosterol, affecting the fungal cell membrane. Effect: similar to azoles, the depletion of ergosterol weakens the membrane, causing increased permeability and cell death. 4. Other glucan synthesis inhibitors. Target site: Drugs such as caspofungin, micafungin, and anidulafungin target the synthesis of beta-glucans, which are essential components of the fungal cell wall. Mechanism of action. These drugs inhibit the enzyme beta-glucan synthase, disrupting the formation of beta-glucans in the fungal cell wall. Effect. The disruption of beta-glucan synthesis weakens the cell wall, making the fungus more susceptible to osmotic stress and cell lysis. 5. Bind to ergosterol and form pores, channels. Mechanism of action. This is a general description that includes the action of polyenes, as mentioned earlier, which bind to ergosterol and form pores or channels in the fungal cell membrane. Effect. The formation of pores or channels disrupts the integrity of the fungal cell membrane, leading to increased permeability and cell death. Understanding the specific sites of action helps in selecting the appropriate antifungal drug based on the type of fungal infection and its severity. These are classification based on action. These are classification based on chemical nature. These are classification based on site of infection. Now let's briefly discuss about the classification of drugs and its action. Polyene antibiotics, amphotericin B. It is a macromolecule and consists of both lipophilic and hydrophilic groups, that is, amphoteric in nature, obtained from Streptomyces nodosus hydrophilic part, and here the structure is mentioned below. Mechanism of action. Amphotericin B is a broad-spectrum antifungal medication, and its mechanism of action, MOA, involves its interaction with the fungal cell membrane. Here's a more detailed explanation of the MOA of amphotericin B. Mechanism of action. Binding to ergosterol. The primary target of amphotericin B is ergosterol, a sterile component unique to fungal cell membranes. Amphotericin B has a high affinity for ergosterol. Formation of pores or channels. Once amphotericin B binds to ergosterol, it forms pores or channels in the fungal cell membrane. Disruption of membrane integrity. The pores created by amphotericin B disrupt the integrity of the fungal cell membrane. This disruption leads to increased permeability of the membrane. Loss of intracellular contents. The increased permeability allows leakage of essential intracellular components, including ions and other molecules, from the fungal cell. This disturbance in the internal balance of the cell is detrimental to its survival. Cell death. The cumulative effect of membrane disruption and loss of intracellular contents ultimately leads to cell death in the fungal organism. It's important to note that while amphotericin B is highly effective against a broad spectrum of fungal pathogens, it can also interact with mammalian cell membranes to some extent. However, the selectivity for ergosterol in fungal cells contributes to its preferential action against fungi. Amphotericin B is often reserved for serious systemic fungal infections due to its potency, but it can be associated with significant side effects. Lipid formulations of amphotericin B have been developed to reduce toxicity while maintaining efficacy in certain clinical situations. Let's move on to the pharmacokinetics. Yellowish color powder, unstable in aqueous solutions, given through IV route in salt form, metabolized in liver. Uses of the amphotericin B. Amphotericin B is used to treat serious, life-threatening fungal infections like intestinal candidiasis, topical candidiasis, febrile neutropenia, leishmaniasis, Kala-Azar, ADR, nausea, vomiting, stomach pain, diarrhea, upset stomach, loss of appetite, muscle or joint pain, nephrotoxicity, bone marrow depression. Next, we move on to another drug on antibiotics, nystatin. Nystatin is a polyene antifungal drug that has broad-spectrum fungicidal and fungistatic activity against a number of yeasts and fungi, most notably Candida species. It is one of the most effective antifungal agents synthesized by bacteria, in this case a strain of Streptomyces norsii. Similar to AMB in antifungal properties, high systemic toxicity, so used locally, only poorly absorbed from mucous membrane. Available as ointment, cream, powder and tablet. Used to treat topical infections. Earlier it was used to treat moniliasis. Here are the uses of the drug. It is used to treat Candida infections of the skin, including diaper rash, thrush, esophageal candidiasis, vaginal yeast infections. Side effects are diarrhea, nausea, stomach pain or upset, vomiting, contact dermatitis, Stevens-Johnson syndrome, hypersensitivity reactions, skin irritation or redness. Next drug, griseofulvin. Griseofulvin is an antifungal agent derived from the mold Penicillium griseofulvum, fungistatic systemic drug for superficial fungal infections, active against most dermatophytes. The mechanism of action, MOA, of griseofulvin involves its interaction with fungal cell division. The primary target of griseofulvin is the microtubules in fungal cells. Microtubules are important structures involved in cell division, providing structural support and serving as tracks for the movement of organelles within the cell. Griseofulvin disrupts the formation of the mitotic spindle, a structure formed during cell division that helps segregate chromosomes into daughter cells. By inhibiting the formation of the mitotic spindle, griseofulvin interferes with the normal process of fungal cell division. This leads to the arrest of fungal cell growth and division, ultimately preventing the spread and reproduction of the fungus. It's important to note that griseofulvin is not effective against all types of fungi, and its use is generally limited to certain dermatophyte fungi that cause infections of the skin, hair, and nails. Griseofulvin is used to treat fungal infections of the skin and nails. It is used to treat infections such as ringworm, athlete's foot, jock itch, and fungal infections of the scalp, fingernails, or toenails. Side effects: rash, numbness or tingling in your hands or feet, yeast infections in your mouth, stomach pain, diarrhea, heartburn, nausea, vomiting, mild hepatotoxicity. Until now, we cleared about the antifungal. Remaining drugs we will discuss in the next video. Thank you.